a rehab is not a structure. Because, like, I won't name where I used to work, we have a structure and we are saying this building is a rehab. But if you get there, there is nothing. But in the name, when you go to Nakada, they will be saying County X has a rehab. They have a structure and not a rehab.
But
this
so
cannot be a media house if there are no services that are being offered. The structure is there, just like a school is not a school without children. So you find most of these counties, they have very nice structures built with the public money, but it is not functioning. He talked about licensing. One of the requirements is that part of that money from licensing is supposed to do research, that is like baseline survey in the counties, community awareness or public education. It is supposed to do treatment and rehabilitation for the people of that particular county, but it is not happening. So you find that they refuse to put what we call the alcoholic drinks fund. The money is put in the normal coffer. So it is not kept in a separate account so that they can be able to account this money. 25 or 15% goes for public treatment and rehabilitation, research and education. The counties have not done that, apart from just a few who have done it.
Okay.
Now, when we come to treatment and rehabilitation, we say these are two services. Treatment is any intervention that you give to a person who is addicted to drugs to help them recover from their drug use or drug abuse.
Okay.
Rehabilitation is where you put them in a place to relearn what they lost, the skills that they lost. And it is not everybody who is using alcohol and drugs who requires to be in a rehabilitation facility, but they all require treatment. Meaning they can get two types of treatment, a residential or an outpatient. Residential meaning they are in a facility, be it be in a hospital for medical management, be it be in a treatment and rehabilitation facility. So, and these have their processes. The first thing you do, the public has the first role, early identification. If we realize that you are using substances, can we refer you to this health practitioner for assistance? The second one is if it goes beyond, this person goes for further screening. There are those who will be managed by the intervention at the local level. They can be referred to the next level because you may never know the extent of damage if the person does not go. For example, there is this famous statement of kutoa. This is somebody who has already reached the other level, meaning he cannot stay an hour without alcohol in the system because of withdrawal. That is when they start having hard tremors, they can't stand, they can't talk up well. But when they get a sip, they are able to talk normally, meaning they are taking the morning drink to normalize, to stabilize. These people cannot stop drinking on their own. They need medical assistance.
Then is it wish we really had enough time to delve into the affordability of it, but briefly, is it affordable, the treatment of it? Because I mean, he mentions a number of them are private, facilities.
I would say all the rehabs are private apart from those few that are run by the government. Incidentally, they are even more expensive than some of the rehabs. Treatment is manageable. It depends on where somebody's mind is. Because, number one, let me ask from the other way, is alcohol free? Is cannabis free?
Okay.
Every service will cost you. You go to a doctor, he will charge me 3,000, consultation fee for 5 minutes. Isn't that more expensive than me who is charging you 3,000 in an hour? So I would say it is affordable. It depends on where the person is looking for the services. If you want the high cost, they are there, and there are those that are moderate.
Prof,
what I'm saying about the affordability, The rehabilitation, of course, it depends because Dr. has taken us through, the kinds of rehabilitation which can be done, and not necessarily going into, inpatient rehabilitation. Inpatient rehabilitation is expensive because, we are talking of at least 100,000 in 3 months. The cheapest maybe, but there are some which are as expensive as 1,500,000, depending on the nature. So it is expensive. But there is something which she has also mentioned. Not everybody who is addicted, actually needs to get into a rehab as such. Because it depends on the levels and also the nature. We have the home-based care system, which we are thinking about now, where you can get help from the comfort of your home, with the community around, and with the maybe seeing a doctor once in a while, and getting that kind of support. That may be more manageable because when we have those kind of home-based care system, it will be a little bit more cheaper, more manageable, and you will be in the community. They will be observing you, and when they are observing you, you are with your people, it may be easier than when you are put somewhere. Then after 3 months, you come back. When you come back, you find the situation is still the same, you relapse. But when we are monitoring you, then it is easier for us to see how far you are you are advancing, how you are doing, and then we can be able to intervene easily.
Right. Even because I'm really out of time here, as your last words, the role of society, fine. I mean, they've undergone this rehabilitation program. Maybe it's 3 months or maybe it's 6 months. What now is the whole role of society in, getting them back? Even as you're mentioning, see no evil, hear no evil, do no evil. What's the role of society? I'll start with the Prof. To
get to support. If this person is from a rehab, the society should now give these people support. And this person, because most of them are idle, they don't have anything to do. So we need to see, as we rehabilitate these people, are we reintegrating them? Are we bringing them into the society in a scenario where they don't come back to the same environment which made them actually get into the problem in the first place? Right. So how are we reintegrating them? Yeah. Are we empowering them in a way which will make them, more occupied, give them something to do, It's important to think about the reintegration.
Right. Dr. We live in a society where you maybe find even in a vehicle, in a matatu, you'd find a graffiti of maybe a musician, who's doing drugs, and even in music videos where it looks cool, even for the young people, where we're even seeing the age that is in this report. This is the society we live in right now.
Yeah, it is interesting that we have normalized everything. One time I was walking from this Water Plaza down, and then I got a matatu here, and the